Welcome to Integrity Linguistics Institute. All right, so OET Listening Part C. So let's see what we'll be covering in today's session. So let's talk about the class agenda for today, right? So let's see what we'll be covering today, because it is very important that you understand what topics we'll be covering and what benefits you will be getting towards the end of the session. So in today's session, we will be covering two very important inference-based questions. Okay, from OET Listening Part C. So inference basically means conclusion. Okay, that is, you have to use your reasoning skills and you have to self-reflect on it. It requires a little bit of a reflection, and then you have to draw your own conclusion. That means the answer will not be directly stated in the audio. The answer will not be directly stated. It is going to be implied. Okay, so these questions, okay, so here the OET is not assessing whether you know English. Always remember this. This is not a language proficiency test where the OET is assessing whether you speak English or whether you can understand English. It is testing certain abilities. So these questions over here, so both these questions that we'll be discussing today, it is going to test your ability to understand the main idea of the speaker. That is, the speaker will not say, this is my main idea. The speaker will not say, this is my suggestion. The speaker will not say, this is the purpose. Okay, they will not say, this is the reason why I'm saying this. You have to, okay, even though it is not said directly, even though the speaker is not saying it directly, you have to sense it by the tone, by the voice modulation, by the intonation, okay, by understanding what question it is, by the words they are using, and so forth. Okay, so that deduction skill is extremely important. And again, it does not happen from day one. Okay, it progressively only you will be able to develop the skill. So commitment and consistency is extremely important. So we'll be talking about osteoarthritis. Two questions over here will be about osteoarthritis. That is, how to identify complex causes and eliminate the incorrect answer options, and how a speaker is correcting a false belief. Okay, correction basically means what? Pointing out a mistake. Okay, so 38th question, it is going to be pointing out a mistake that when we do the question, you'll be able to understand. So what to expect in today's session? In today's session, you can expect a clear explanation of what inference type questions are. Okay, what these type of questions are. And we will be discussing with you some strategies, that is step-by-step strategies on how to find the correct answer when it comes to inference type questions. Then we will be doing some vocabulary support. Okay, because the OET is not going to repeat the same words in the question as well as the audio. They're going to be using paraphrased speaking. So you need to have access to advanced vocabulary range. Okay, so we'll be doing a synonym matching exercise as well. Okay, and then we'll be giving you some listening tips to help you stay focused and confident. Okay, because your mindset is very important. Okay, it is in which mindset you are. If it is a positive mindset throughout the preparation phase, then the result is going to be positive. If you are practicing the OET in a negative state of mind, and if you're executing the OET in a negative state of mind, the result also is going to be negative. All right, and then we'll be practicing with real OET style questions. Okay, so this is what we'll be discussing. Okay, so we'll be sharing all this with you. All right, so just one small tip over here. So listening part C. Okay, listening part C is not about just hearing words, because when we hear the word listening, okay, everyone think, oh, all I have to do is just listen. How difficult it is to listen. It is not simply hearing. Right. It is also about understanding the meaning. Okay, the information coming from directly stated information and the information which is not directly stated. You should be able to grasp the meaning. And today we'll be training your ears. Okay, so again, we are all in the preparation phases. So I'll be training your ears and sharpen your thinking. Okay, so let's make the session count. Okay, so don't worry, I will definitely be teaching you the right strategies and all that. Okay, but first I want you to put in the effort and try to find the answer on your own. So this is the 37th question, and I will be playing you the audio as well. So you listen to the audio, you try to find the answer, and then you type your answer in the chat box. It does not matter if it goes wrong. Right. So now let's take a look into the extract that we are dealing with. So a small introduction regarding OET Listening Part C. OET Listening Part C consists of two extracts, extract 1 and extract 2. And it may be an interview or it may be a presentation. Okay, so in part C, you'll be getting two separate audios. Both audios will be minimum 5 minutes long. And for each audio, there will be 6 multiple choice questions. Right, you have to choose the correct answer option. So for example, if you believe answer option B is the correct answer, if you're choosing pen and paper based test with your pencil, you have to shade B as the correct answer like this. Okay, so that is what you're supposed to do. Now, it can be an interview or it can be a presentation. Now, see over here, extract 1, you hear a microbiologist, Dr. Jane Finn, giving a presentation about the overuse of antibiotics. So presentation basically means you are just hearing one person speaking. Okay, that is just one person speaking. Now that is what we call as a presentation. But sometimes you can expect, interviews. Interviews basically means what? A 5 minute long audio wherein which there will be two people speaking. That is an interviewer and an interviewee. So you can expect two interviews, you can expect two presentations, you can expect one interview, or you can expect one presentation. So here in this particular question paper, both the extracts over here are basically presentations. So extract 2 is what we'll be discussing today, inference type questions. Again, let me just give you a warning. The 38th question is going to be very difficult. 37 questions also slightly advanced only. So it is going to be very challenging. I'll do my best, okay, to make it as easy for you. So let's see what the theme of the conversation is. You hear a rheumatologist. Okay, so whose voice are we hearing? You were hearing the voice of a rheumatologist called Michael Evans. Okay, so this is the person who's speaking, and he's a rheumatologist. And what is the topic he is talking about? Osteoarthritis. Okay, so he is over here talking about osteoarthritis. Okay. Now they give you 90 seconds time. Okay, so let me just give you a small heads up when you get this 90 seconds time. So this is something that you have to keep in mind, that the OET is trying. Okay, the OET has been designed in such a manner to make sure that you don't think very clearly. Okay, Achinju, you can go. I understand you have duties. All right. So we understand that OET, the OET question paper. Okay, the OET question paper has been designed in such a way that it is going to push you into anxiety mode. Okay, so those who have attempted the OET question papers before, if you feel anxious, if you feel nervous, if you feel distracted, it is not your fault. Let me tell you, the if all that feelings that you encounter, that is, you're not able to focus, you're not able to concentrate, you're not able to think clearly, your mind is going away, you're thinking about something else, you're thinking about the previous questions. Okay, you're getting a little bit concerned, you get a little bit worried. Okay, and you go into panic mode. Okay, so all these things that you feel, it is not your fault, it is expected. Okay, the OET has been designed in such a way to push you into that kind of mode. Okay, so the message I'm trying to give is this will happen. Okay, this is bound to happen, it is inevitable, right? So the minimum that you can do, is not push yourself into anxiety mode. The OET is trying to push you into anxiety mode. You don't push yourself into anxiety mode. Okay, so when you get 90 seconds time, okay, they give you 90 seconds time and it is for your own benefit. Okay, so with a cool, calm, clear mind, okay, forgetting all the 36 questions. So you have done question number 1 to question number 36. You just forget all that. It doesn't matter if it went very good. It doesn't matter if it went very horrible also. You just remove all that from your mind. You tell to yourself, okay, I'm here in the second extract of listening part C and I have 90 seconds time. So let me just think very clearly, because the more clarity I have, the more quality of thinking I'll have. The more quality of thinking I have, the more judgment I'll be able to, my judgment quality is going to be much more higher. And if I am able to judge the information better, I'm going to select the correct answers more easily. So when you get 90 seconds time, unlike other students, some students, what they do is they will push themselves into anxiety mode. They will just simply read 37th answer the question. They will just blindly read. Okay, what does Michael suggest about helping patients with osteoarthritis? It's easiest when the patient is young. It may involve dealing with a range of problems. It will be more difficult if the condition is genetic. So like this, very quickly, they will read the question, three answer options. This also they will very quickly they will read, and this also very quickly they will read. Okay, and then they will read the entire six questions maybe two or three times. Because what are they thinking? They are thinking the more quantity I have, okay, that is more quantity is better. That is what they think. Okay, but let me tell you, quantity does not matter. It is quality. Okay, even if your reading is just one time, okay, if you are reading just once, okay, but that one single time, if you're reading with clarity, if you're reading with an intent, okay, we are reading with an understanding, you're interacting with the question paper, you're taking your pencil, you're underlining the keywords, you're highlighting the keywords, you're making notes, just one single time, if you're reading these six questions during the 90 seconds time, you are not overburdening yourself. The OET is trying to push you into anxiety mode, but you are refusing to fall into that trap. You're thinking very clearly, and you're reading with a high quality. And what happens is you're going to register this information much more clearly in your mind. So when the audio is going to play, they can use a lot of synonyms. They can use a lot of different words. But still, since you read with a lot of clarity, you will be able to, select the correct answer. So it should always be an investment of time. Okay. So when you get 90 seconds time, it's always be an investment of time. Okay. That is, the benefit should come in the future. All right. So that's very clear, right? So now that being said, everyone read the 37th question. Just give me a second. Let me just share the screen once more. Yeah. Read the 37th question. And be prepared to hear the audio right now. After that, I will be teaching you. Okay. All right. So I'm going to play the audio now. Now let's hear the audio script.
Hello, I'm Michael Evans. I want to tell you about the work we're doing on a condition that affects 1 in 10 people in this country, and that's osteoarthritis. Osteoarthritis typically affects the knees, hips or hands when the cartilage that lines the joints starts to wear away. So how can we help patients with osteoarthritis? When I was at medical school, and that's a long time ago now, the theory was that it was due to wear and tear, an inevitable part of getting old. You still sometimes hear this, but it's one of the many myths about the condition. After all, we have teenagers who develop it, and every joint has the capacity for repair. So we should think of osteoarthritis as a situation where processes for tissue repair are overwhelmed by destructive processes that often relate to injury, weight, and mechanical load factors. But there are also other risk factors. Genetics may play an important role, and occupation makes a difference too, of course.
All right. So that was the audio. All right. So do I need to play the audio once again? It's a slightly tough question, not a very easy one. So I'll just play the audio once again, and then we'll have the discussion. Now let's hear the audio script.
Hello, I'm Michael Evans. I want to tell you about the work we're doing on a condition that affects 1 in 10 people in this country, and that's osteoarthritis. Osteoarthritis typically affects the knees, hips or hands when the cartilage that lines the joints starts to wear away. So how can we help patients with osteoarthritis? When I was at medical school, and that's a long time ago now, the theory was that it was due to wear and tear, an inevitable part of getting old. You still sometimes hear this, but it's one of the many myths about the condition. After all, we have teenagers who develop it, and every joint has the capacity for repair. So we should think of osteoarthritis as a situation where processes for tissue repair are overwhelmed by destructive processes that often relate to injury, weight, and mechanical load factors. But There are also other risk factors. Genetics may play an important role, and occupation makes a difference too, of course.
All right. So that was the audio. All right. So what is the answer? So it doesn't matter if your answer goes wrong. Type your answer in the chat box. Is it answer option A? Is it answer option B? Or is it answer option C? Right. So let's take a look into the question. Okay, so here I have prepared a document, and that we'll be taking the document once we have read the question as well as the answer options. Right, so we have, okay, let's just take a small look. Okay, so we have A, C, C. All right, good. Okay, good, good, good. Appreciate the participation. So let's take a look into the question. What does Michael suggest about helping people with osteoarthritis? So what is the question stem over here? So let me just type over here, the question stem. So if you identify the question stem, automatically you will be ultra focused. You can ignore all the useless information, because in OET, a lot of useless information, a lot of distracting information will be there, and you will be able to ignore them if you understand the question stem. That is the focus of the question. Okay, so what is the focus of the question in this particular 37th question that they have asked you? It is, what does Michael suggest about helping patients with osteoarthritis? So it would be this one. So here, this rheumatologist over here, he is suggesting something. Okay, so that means answer option A, answer option B, and answer option C. All of these are what? Answer option A could be a suggestion. Answer option B and answer option C are all suggestions made by Michael about helping patients with osteoarthritis. So what is your duty here? Your duty over here is to find what is the rheumatologist suggesting about helping patients with osteoarthritis. That is the only thing. So you don't have to know what is osteoarthritis. You don't want to know what causes osteoarthritis. You don't want to know what are the risk factors of osteoarthritis. You don't even want to know what are the complications. Okay, so complications, risk factors, etiology, epidemiology, population interfacts, that and all is nothing important to us. Here, what is the rheumatologist suggesting on helping people with osteoarthritis? That is the only duty. So first and foremost, you have to understand, okay, this is a question, this is a inference type question. That is, you have to, that means you have to, the answer will not be directly stated. It is going to be implied, and you have to think from the perspective of the speaker. And your duty over here is to find what is the suggestion made by Michael. And that means answer option A, B, and C are all suggestions. And your duty is to find the correct suggestion. Now, before I go into the answer options, let's just take a look into the keywords of the question over here. So what does Michael suggest about helping patients with osteoarthritis? Okay, now you know your duty over here. Michael's suggestion is what we need to find out. Now, let's take a look into answer option A. Now, answer option A, answer option B, and answer option C. We have so many it's over here. Now, what is it referring to? This is very important. So I'll give you 10 seconds time to think and type the answer in the chat box. What is it over here? What is it? Because if you don't understand it, then this is meaningless. Such a tiny word, but it is the most crucial element of this particular question. What does it refer to? All right. Osteoarthritis, osteoarthritis. Is there any other answers coming from anyone? It referring to osteoarthritis, right? So here we have everyone going with it means osteoarthritis, right? So we have all these things and we have all chosen osteoarthritis. Is there anyone else? All right. Now, what if I told you that is not the correct answer? What if I told you that is not the correct answer? The correct answer is not osteoarthritis. It is basically this word over here. Helping patients. No, not suggestion. It is helping patients. Because what is the question asking you? What's the theme of the question over here? About helping patients. So that means what? There are patients who have osteoarthritis. Patients are suffering from osteoarthritis. And what is the rheumatologist's duty? The duty of the rheumatologist is to help patients. Right. Now, about helping patients, about people suffering from osteoarthritis, he is making a suggestion. Now, you see over here, suggestion about helping. That is what is mentioned. Suggestion about helping. So, this is the foundation. This is the basic of OET. Okay. So here your duty is to find the suggestion about helping patients with osteoarthritis. So it basically means what? It is basically helping patients. Now you make the connection. Now you read like this. Helping patients with osteoarthritis is easiest when the patient is young. Okay. Now you read like that. Now you see, so instead of reading like it, you read like this. Helping patients with osteoarthritis. And now you read, helping patients with osteoarthritis is easiest when the patient is young. Does it make sense? Yes, it makes sense, right? So the patient is very, very young, then helping the patient is the most easiest. Helping patients may involve dealing with a range of problems. So if we want to help a patient suffering from osteoarthritis, then the rheumatologist, they have to deal, okay, they have to deal with a range of problems. That is, they have, so if I want to help a patient suffering from osteoarthritis, I have to deal with so many problems. Problem one, problem two, problem three. It is not just one single problem. So many problems I have to deal with if I want to help a person suffering from osteoarthritis. Now, see, what is answer option C? Helping patients with osteoarthritis will be more difficult if the condition is genetic. Okay, that means from the mother, from the father, if a child is getting osteoarthritis, then helping that patient who got it genetically will be more difficult. Now you see, if this you did not make the connection, then it is going to be extremely tough, right, to find the answer, because this is the question stem. Okay, the question, this is okay, there are so many layers. There are so many layers to OET, and they have purposefully designed the question paper like this. So that is why thorough preparation is very important. Okay, so this is the foundation. Okay, so no harm, no harm. There is no need to feel, bad if you didn't get the answer. This is OET that we're dealing with. It's a Cambridge University material. It is not going to be easy. Okay. And mistakes should happen. Through mistakes only, we will be improving our knowledge. Okay. So now let's take a look into the keywords of the answer options over here. Okay. So first one, answer option A, it is easiest when the patient is young. Okay. So if the patient is very young, it is going to be the most easiest. Answer option B, it may involve dealing with a range of problems. A range. Okay, range means what? A wide range. Okay, a wide range means several, various. Okay, various problems we have to deal with. Now, say answer option C, it will be more difficult if the condition is going to be genetic. Now, you see over here, what we have done over here is what we call as the keyword analysis. Okay, so what we did right now is something called the keyword analysis. Okay, this is a strategy. That is, you should be able to identify the keywords like this. Okay, and why are we doing the keyword analysis? We are doing the keyword analysis for step one, which is called comprehension of the question. Step number one. Step number one is understanding the question. And the another word for understanding is comprehension. Comprehension means understanding. And always remember, the OET is not giving you marks for understanding the audio. The OET is giving you marks for finding answers to the question. Okay, that is what your duty is. So understanding the question is even more important than understanding the audio. Let me repeat that. Understanding the question is more important than understanding the audio, because OET is giving you marks for understanding the question. That is what we call as comprehension. And to do comprehension, we should be able to do the keyword analysis. Next comes retention. Retention basically means what? Once you have understood everything, you must register this information to your memory. Okay? You must not forget what you understood. Okay, this should be registered into your memory. That is what we call as retention. That is, retain the memory of the question. So that when you're listening to the audio, your mind will tell you, okay, my duty is to find suggestion about helping patients. Suggestion, what is the person saying about helping, suggestion about helping patients. That memory should be there. If that memory is there only, you will be able to, pinpoint the correct answer. And then the third step is what we call as detection. And now it is your duty to detect what the correct answer is, right? And in most cases, detection can be done with the elimination strategy, right? Elimination strategy. That means what? Instead of choosing the correct answer, you try to eliminate the incorrect answer options one by one. So at least one answer option, if you're able to eliminate, right, then you are left with 50-50 chance. At least one, if you eliminate properly, then you have a 50-50 chance of success. And if two answer options, if you eliminate, then you have a 100% chance of choosing the correct answer, right? So that is how important the elimination strategy is. Okay. And for that, I'll be teaching you something called as the verb analysis. Verb analysis, or I would say the focal point. Okay. The focal point of the answer options. Okay, so what is a verb? Verb basically means an action, any kind of a movement. Okay, that is what we call as a verb. Okay, so we have nouns, we have adjectives, we have verbs. Verbs basically means any kind of an action. Okay, so most of the time, the focal point of the answer option will be a verb. Okay, so remember comprehension, retention, detection. So we have done the keyword analysis like this. Now let's see what are the verbs over here. Okay, that is what are the focal points of the answer options. Now, let me just, yeah. So here, suggestion about helping. This is what you need to find out. Okay. So first answer option over here is, it is easiest when the patient is young. Okay. So over here, this is the, okay, this is the focal point. Okay. It is the easiest. That is, helping patients is easiest when the patient is young. So that is the suggestion. Okay. Suggestion is, he is talking about the most easiest method to help a patient is to find when the patient is in the early stages. That is, if it is a young patient, we can help him very, very easily. Okay, so this is not a verb over here. It is basically a focal point. Now let's come to the focal point of answer option B. It may involve dealing with a range of problems. Now, what is the verb over here? What is the action over here? Dealing. Okay, dealing is the verb over here. Okay, so dealing with a range of problems. Okay, so dealing with a range of problems is the suggestion about helping patients with osteoarthritis. And let's come to answer option C. C is telling it will be more difficult if the patient is genetic, if the condition is genetic. So it is. So this is exactly the opposite of A. It is going to be more difficult if the condition is going to be genetic. Now he is talking about the difficulty if it is going to be so and so. Okay, so here again, it's a very tough question. Maybe in easy questions, this becomes a little bit more easier for me to understand. Okay, so now anyway, now you see over here, when you get the 90 seconds time, and when you're about to listen to the audio over here, you should have this clarity. That is, before the audio is playing, you should have this clarity. Okay, my duty is to find the suggestion about helping patients with osteoarthritis. So option number one, suggestion number one is easiest when the patient is young. Suggestion number two, okay, in helping involves dealing with a range of problems. And then option number three, helping is more difficult if the patient is genetic, condition is genetic. So, that clarity you should have in your mind. Now, before I go to the audio script, what you need to do is, I'm going to give you two strategies. Okay, two tips I'm giving you. Now, you see over here, when I show you this particular slide, your eyesight is going everywhere. Now, as soon as I highlight this word, now see, I have highlighted the word effect over here. Now, every one of you is directly looking into this word. Your eyesight can be anywhere, right? Your eyesight can be anywhere, but for some reason, everyone's eyesight is over here. If I remove this and if I put my keyword highlight over here, now everyone is automatically, without even me telling you, you're looking over here. So your brain is automatically drawn to the word that has been highlighted. Okay, so when you get your question paper, you should interact with the question paper like this. Okay, so if you underline the important words like this, circle the important words like this, what happens is your brain is automatically focused on these words, right? So when the audio is going to play, it becomes much more easier for you to find the answer. That is, your brain is helping you because your brain is automatically focusing on the keywords. Okay, so this is one benefit over here. All right, so that is tip number one. And tip number two is when the audio is playing, your eyesight should only be on the answer options. When the audio is playing, when you're trying to find the answer, you should not read the question, right? So again, this is very, very important. The memory of the question should be thorough. This is why retention is very important. So here your duty is to find Michael's suggestion about helping people with osteoarthritis. That memory should be there. When the audio is playing, you should not read the question. When the audio is playing, okay, suggestion about helping people. Okay, and then when you're listening to the audio, your eyesight should only be in the answer options. Okay, otherwise you are going to distract yourself. The OET is trying to distract you, and if you yourself are trying to distract you, then it is going to be very easy for you to choose the correct answer. Right. So now let's take a look into the audio script over here, and then we will be taking a look into the document that I have prepared. Right. So let's just take it. All right. So everyone has the memory of the question, right? So let's just read the question once again. Michael's suggestion about helping people with osteoarthritis, easiest when the patient is young, dealing with wide range of problems, more difficult if the condition is genetic. Okay, so that memory is there. So now, before I go to the next, the document that I have prepared, let's just read the audio script. Okay, so we have listened to the audio 2 times. Now let's read the audio right now. The script over here. So he's saying, hello, I'm Michael Evans. Okay, so what is our duty here? To find the name of the person? No, right? So these are all distractors. Okay, these are all distractors. So he's just telling who he is. Okay, he is Michael Evans. And he is telling, I want to tell you about the work we are doing on a condition that affects 1 in 10 people in this country. Okay, that is 10% of the population. 1 in 10 basically means what? 10% of this country is having osteoarthritis. Now, what is your duty? Is your duty to find how many people suffer from osteoarthritis? No. Your duty is to find about helping people with osteoarthritis, what suggestion Michael is giving. So this is another distractor. So you can tell yourself, this is another distractor. This is not important to me. Now let's go to the third sentence. Arthritis typically affects the knees, hips, or hands when the cartilage that lines the joints starts to wear away. Okay, so now he is talking about the mechanism of osteoarthritis. That is, osteoarthritis, it affects the knees, the hips, and the hands. Okay, and how does it affect? When the cartilage, that is a protective layer, okay, of the joint, when it goes wear away means it starts to deplete. Okay, so when, small depletion is happening, when its quantity is reducing, that is when osteoarthritis affects. Now, what is your duty here? Is your duty to find or which parts of the human body gets affected by osteoarthritis? No, right? Your duty is to find there are patients suffering from osteoarthritis and how to help them. Okay, suggestion regarding helping patients. So this is another distractor. Again, you should be able to discriminate the information like so and so. Now let's come to the next part of the audio script. Now he is saying, so how can we help patients with osteoarthritis? Now this is where you have to become alert because this is our duty. Okay, this is the stem of the question. So he is asking you, how can we help patients with osteoarthritis? That is, there are people with osteoarthritis and how can we help them? Okay, so now you should become alert. Okay, now maybe the suggestion is going to come. Suggestion about helping people. Now let's see what he's saying. When I was at medical school, what is the tense over here? So we know he is a rheumatologist. That means he is a experienced doctor over here. Okay, now he is saying when I was at medical school, that means when he was a student. So here he is talking about past tense. Okay, that is when I was at medical school, and that's a long time ago. So it's a very long time ago when I was a student. The theory was, okay, there was a theory. Again, this is something that is existing in the past, that it was due to wear and tear. Now, what does the word it refer to? Here it refers to osteoarthritis. Okay, so here it is referring to osteoarthritis. Okay, so he's saying when he was a student very, very long time ago, people thought there was a theory. And what was the theory? People thought it was due to wear and tear. Okay, so for example, if you wear the same jeans 365 days a year, how is the jeans going to look like? Okay, you keep on wearing it, it will keep on becoming, it will, it will fade away, the color will go, right? It will tear here and there. So that is what we mean by wear and tear. Wear and tear means the more you use. Okay, so this is a phrase. Okay, this is what we call as phrases. Okay, so this is a phrase that's saying, so it was due to wear and tear. That is, the more we use, the joints, osteoarthritis comes. Okay, that's the meaning of wear and tear. So this is an old theory. It was due to wear and tear, an inevitable part of getting old. So as the human body ages, we walk, we run. Okay, so a lot of wear and tear is happening. And because of this wear and tear, the theory was people get osteoarthritis. This is a very old theory. Now, what is your duty? Is your duty to understand what the old theory was? No. Your duty is, okay, how to help people with osteoarthritis. So you can say, this is another distractor. The OET is just trying to distract me. This is not important. And now he's telling present tense. Now he's coming to the present. You still basically means what? Present tense. You still sometimes hear this. That is sometimes, okay, so there are some people who still believe that osteoarthritis happens because of getting old. Okay, but it's one of the many myths of the condition. Okay, so regarding osteoarthritis, he's saying there are so many myths about the osteoarthritis, and this is one of the myths. So till now, did we hear anything about helping, the suggestion about helping people? No. Okay, so we are still yet to listen to the answer. So let's keep hearing, keep reading. Now he's saying, after all, we have teenagers who develop it. Now you see over here, in the theory, what was the theory? That people who are getting old, only people who are getting old will get osteoarthritis. But now he's saying that is a very wrong theory, because we have very young patients, okay, who do not have wear and tear. Even we have teenagers who are developing osteoarthritis. So he is saying that is a myth. Okay, so he is actually, canceling a myth. The myth is only old people get osteoarthritis, but he is canceling the myth by telling we have teenagers who are getting it. Again, not helping. The suggestion about helping is what we want to hear. So this is nothing related to that. So this is another distractor. Okay, so the reason why I'm repeatedly saying this is to train you to understand what is a distracting information and what is a useful information. And now he's saying, and every joint has the capacity for repair. So every joint of the human body is capable of repairing itself. Now he's saying, so we should think of osteoarthritis as a situation where the processes for tissue repair are overwhelmed by destructive processes that often relate to injury, weight, and mechanical load factors. So now what is he saying? So now he is saying, okay, the reality of osteoarthritis. Okay, so if we have a patient and if the patient is suffering from osteoarthritis, what is the situation? Okay, the situation is the processes for tissue repair are overwhelmed. Okay, so for example, if I give you 1 kg dumbbell, it is going to be easy for you. If I give you 5 kg dumbbell, that is also going to be easy. But if I give you a 40 kg dumbbell, are you going to find it easy? No, you're going to feel overwhelmed. Okay, overwhelmed means too much. It is too much for me to bear. So here you have to understand what is saying. The human body has the ability to heal. Okay, he's saying every joint in our body has the capacity for repair. There is no need for us to give any medicines. Without giving any medicines, the body has the capacity to heal. But in osteoarthritis, the tissue repair is overwhelmed. Okay, that means the body is trying to heal. That means we have a patient who is having osteoarthritis. Every joint in his body is trying to repair itself. Okay, tissue repair is trying to happen, but unfortunately, the body is overwhelmed. Okay, the patient's body is not able to repair itself because it is dealing with so many problems. It is overwhelmed. Okay, and it is overwhelmed by destructive processes. Now, what and all are the destructive processes? So he is saying number one. Okay, so if there is injury, okay, so the patient's body is trying to heal itself, but the patient's body is injured. So if the patient's body is injured, it is extra stress on the body. Okay, so extra stress basically means the patient's body is overwhelmed. Now, what is the second situation? The second situation is body weight. Okay, the patient is very, very obese. Okay, so the patient's body is trying to repair itself, but the patient is very obese. So the patient's body is overwhelmed. It cannot repair itself. And also mechanical load factors. The patient's body is trying to heal itself, but the patient is lifting very things. Look, at the patient is running, the patient is jumping, the patient is doing a lot of physical activity. So there is a lot of load on the body. So once again, the body is overwhelmed. The body is not getting time to heal itself naturally. So that is what he is suggesting. Now you see, this is the suggestion. Okay, so when we have a patient who is suffering from osteoarthritis, we need to understand the body is trying to heal itself, but the patient's body is overwhelmed by so many destructive processes. That is injury, weight, and mechanical load factors. But there are also other risk factors. Now he's saying other risk factors are also there. What are the other risk factors? So let's see what other risk factors over there. Now you see, other risk factors, genetics may play an important role. So now he's talking about genetics also plays an important role, and occupation makes a difference too. And okay, so some people have genetics, that is their parents or grandparents had rheumatoid arthritis, so that is another stress on the body. The body is trying to heal itself, but the patient's genetics is having what, the patient's genetics is not allowing the body to repair itself. Okay, and also the occupation. So if the patient is working as a gym trainer, or if the patient is working like a daily wager where he has to lift a lot of things, then the occupation, the job of the patient is also another risk factor. So here also the patient's body is overwhelmed. Okay, the patient's body is overwhelmed. The body is not getting time to heal itself. So now what do you think? So what is the suggestion over here? So what is he suggesting about helping people? So here he's saying, if we have a patient who's suffering from osteoarthritis, how can we help the people? How can we help the patients? We have to help the patient by, removing the injury. First and foremost, we have to see if the patient is having any injury. So we have to remove the injury. That is, we have to heal the injury. Then we have to reduce their body weight. Then we have to make sure that they are not, they are not doing any kind of mechanical load. Then if we have to see if their genetics are, in their favor. And also we have to make sure that their occupation is not overwhelming them. So when it comes to helping, again, that is the duty over here. So when it comes to helping a patient with osteoarthritis, what is the author's suggestion over here? The suggestion over here is that it may involve dealing with a range of problems, right? So it is going to be answer option B. Okay. Now, why is answer option B over here? Dealing with a range of problems. Because as I told you, the patient's body is trying to repair itself. The patient's body is trying to repair itself. But if the suggestion, so if you are a rheumatologist and if you want to help a patient, then you have to deal with injury, you have to deal with obesity, you have to deal with their occupation, you have to deal with their genetics, and you also have to deal with their mechanical load factors. That means you have to deal with a range of problems. That is the only way you can help people with osteoarthritis. So that is the suggestion that is being mentioned over here. So the right answer option is going to be answer option B. Right. So now let's see why answer option A and answer option C is incorrect. Now again, choosing the answer option B is not very, very easy. Right. So the least you can do. So if you're finding this very difficult, the minimum that you can do is eliminate the incorrect answer options one by one. Okay. So over here, answer option A, it's easiest when the patient is young. So did we hear and read anywhere that helping people is easiest when the patient is young? They do not say anything. He is not saying that, okay, if we get a young person, it is going to be the easiest to help them. Now see, even we have teenagers who develop it, but he is not saying it is easy to treat teenagers. It is not mentioned anywhere. Right. So since it is not mentioned anywhere, we cannot choose answer option A as the right answer. Right. Now, what is answer option C? It will be more difficult if the condition is genetic. Okay, so the word genetic is mentioned. This keyword is mentioned, but is this mentioned over here that it will be more difficult if it is genetic? That if the patient's parents had osteoarthritis, then helping them is going to be very difficult. No, it is not. It is not mentioned anywhere, right? It is more difficult if the patient's osteoarthritis is derived genetically. That is also not mentioned. So A and C is not mentioned, and dealing with the range of problems. So here, what the focus over here is a range of problems, right? So are they talking about a range of problems? Yes, they're talking about so many problems, right? That is, they're talking about injury, they're talking about obesity, they're talking about occupation, they're talking about genetics, they're talking about mechanical load factors. So many range problems they're talking, and we have to deal with them one by one. So the answer option that is the most difficult to eliminate is answer option B. So B will be the right answer. Right. So again, this is a very tough question. So I told you it's not an easy one. All right. So now let's just take a look into the document that I have prepared, and then we will go into the next one. Now, see, this is how you should do a listening. Okay, so there are some students who say, oh, I have done 100 listenings in my life. I have done 300 listenings in my life. You do one listening, but this much clarity, this much thoroughness you do. And just one question paper you practice and you do it thoroughly, you will pass the OET. I guarantee it. Just one or two question papers if you're doing, but with this much thoroughness, dissecting it each and every point, A to Z, understanding why this is mentioned over here, why this is wrong, with that and making some notes. With that clarity, if you prepare just 2, 3 materials you prepare from Cambridge materials, you will be very easily clearing those. It is not about quantity. You can do 100, 200, 300 fake OET materials. It is not going to help you out in any way. Let's take a look into the 37. Okay, so I'll be sharing this document. I'll be sharing this document to you after the session is done. Okay, so this is so the question that we just discussed, the question that we discussed over here, it is an inference type question. Okay, it is not a direct question. Now see, did the speaker directly say that you have to deal with a lot of problems? No, it is not said directly. Okay, it was not at all directly mentioned. Okay, so here you have to bring in the skill to understand the main idea or the suggestion. Okay, so that is, you have to really sense it from the audio. Okay, so here listen for the speaker's opinion. Okay, so that skill you should have. So Michael talks about people what used to believe and what is actually true. Okay, so this and all I'll be later on sending you. Notice the correction. That is, he's correcting the belief, right? So people used to believe what was the old idea, wear and tear from aging, but he's explaining that is not the case. Okay, and then I have developed a vocabulary, this thing as well. That is, these are all the advanced vocabulary we saw in the question as well as in the audio. So all these things I'll be sharing to you through after the session is done. Okay, so if you want, we can make some notes and take it. All right, so now let's go to the next question. Okay, so the next question is going to be even more difficult. Okay, the next question is very difficult. It's little not difficult, but it is very confusing. Okay, so let's take a look into the question. Right, so let me just take the audio script as well. Okay, so now this is the OET exam mastery app. Okay, so now you see, it is almost 50 minutes long. Okay, this recorded lecture over here, it is almost 50 minutes. That is to teach you 6 questions. To teach you 6 questions, it takes me almost 50 minutes to make this audio. So as you can see over here, with photos, with videos, with animations, with Malayalam translations, Hindi translations, and visualization, and very detailed explanations, and color coding. Okay, and simplified this thing, and then answer, explaining why B is the correct answer. Okay, and why A is the incorrect answer. So like that, in very very huge detail, I have made the recorded lectures, and it is available 24/7 access only for our students via the OET exam mastery app, and you will be getting that. So for the new students, I'll be sharing this link and all with you. After the session is done, I will be informing you. All right, so now let's take a look into the 38th question. The 38th question is also going to be an inference type question. All right, so prepare yourself. All right, so this is the 38th question. So everyone read the 30th question. Again, understand the stem of the question, understand the keywords, the verb analysis and all that, comprehend the question, retain the question, and then prepare yourself. And when the audio is playing, your eyesight should only be in the answer options. Okay. We're going to play the audio now. Terms. Now let's hear the audio.
Let's look at some more of the myths surrounding osteoarthritis. Osteoarthritis of the hands is an interesting case because this is one time you might think you can't put the blame on mechanical load factors, but you'd be wrong. There are actually circulating molecules that come from fat, and these influence the development of inflammation in joints. In fact, you're 30% more likely to get hand osteoarthritis if you're obese. And there are a couple of studies going on right now to test the theory that losing weight can have a positive effect on osteoarthritis in the hands. So what?
All right. So all right. So I'm going to play the audio once more because it's a slightly tricky one. Okay. This is a small audio, but it's a little bit challenging. It requires a lot of deep comprehension. Now let's hear the audio.
Let's look at some more of the myths surrounding osteoarthritis. Osteoarthritis of the hands is an interesting case because this is one time you might think you can't put the blame on mechanical load factors, but you'd be wrong. There are actually circulating molecules that come from fat, and these influence the development of inflammation in joints. In fact, you're 30% more likely to get hand osteoarthritis if you're obese. And there are a couple of studies going on right now to test the theory that losing weight can have a positive effect on osteoarthritis in the hands. So what?
All right. So so what could be the answer? Is it answer option A, answer option B, or answer option C? Then this is a very tough question. Not at all an easy one. Not at all an easy one, I guarantee you. So there is no problem if your answer goes wrong. Is it A, B, or C? You can type your answer in the chat box. I'll give you 5 seconds time. Right. Good. All right. So let's take a look into the question over here. Okay. The question over here, let's understand what the stem of the question is. Why does Michael mention obesity in relation to osteoarthritis in the hands? Okay, so over here, what is your duty over here? Your duty here is to find why Michael is mentioning obesity. Okay, so he's talking about osteoarthritis in the hands. Okay, and along with that, okay, in this topic, he's also mentioning obesity. Okay, but there is a purpose for it. There is a reason for it. There is a reason why he is mentioning obesity when it comes to osteoarthritis in the hand. Now, answer option A, answer option B, and answer option C. What are all these answer options? They are all reasons. Okay. Answer option A, B, and C are all reasons. That is why he is mentioning obesity when it comes to osteoarthritis. So the reason number one. Reason number one is to show to how assumptions about it can be wrong. Okay. So now let me ask you, what does the word it refer to? And here also we have it over here. So what does the word it refer to? To show how assumptions about it can go wrong. What is it over here?
Obesity in relation to osteoarthritis in the hands.
Okay, so yeah,
Due
it. So what is it? What is specifically it referring to? Is it referring to the entire sentence that you said? Obesity in relation to osteoarthritis in the hand, or is it a little bit more specific? Okay, it was a very good attempt. Okay, it was a very good attempt from your side. Okay, and I would say you got it 80% correct. Okay, it was 80 or 85% correct, but a little bit more specificity would have given you 100% marks. So here it is referring to osteoarthritis in the hands. Okay, not obesity. Okay, here he is talking only about osteoarthritis of the hands, and he's talking, that is the main topic, and he's bringing in obesity. He's bringing in obesity for a reason. That is our duty. So why is he mentioning obesity? So when he is talking about osteoarthritis in the hands, why is he talking about the body weight of the patient? For what reason is he bringing obesity? That is what your duty is. So here, it is referring to osteoarthritis of the hands. Okay, so now you read the entire sentence. Okay, so you can read like this. Michael, now you read like this. Michael is mentioning obesity in relation to Michael is mentioning obesity in relation to osteoarthritis in the hands because he wants to show. Okay, because means reason, because he wants to show how assumptions about osteoarthritis in the hands can be wrong. Say how? So there are some guesses, there are some belief system about osteoarthritis, and he wants to show us that they are wrong. They are not correct. Okay, so to prove it is wrong, to prove these assumptions are wrong, he is talking about obesity. Okay, now let's come to answer option B. Okay, so why is he mentioning obesity? He wants to explain to us the role of fat molecules in the development of osteoarthritis. Okay, so in a patient, the osteoarthritis develops because of fat molecules. So he wants to explain this to us. He wants to explain this to us. This is the reason. Okay, so the reason why he is talking about obesity is to teach us, is to explain to us like how fat molecules leads to the development of osteoarthritis. So it is once again referring to osteoarthritis, not obesity. Obesity is just a reason. Okay, and here there is no, to illustrate how attention to diet can alleviate the symptoms. Again, symptoms of what? Symptoms of osteoarthritis, not obesity. Okay, so he's using obesity to illustrate how if a patient is giving attention to their diet, how it can minimize the symptoms of osteoarthritis in the hands. Okay, and for that, he's using obesity as an example to explain us that reason. Okay, so good. Now let's take a look into the keyword analysis of answer options A. Now, to show how assumptions about it can be wrong. Okay, so he wants to tell us that there are some belief system. People are thinking osteoarthritis is like this, so and so, and he is proving it. He's saying, no, that is not correct. Okay, this is correct. Okay? And he is proving it wrong by bringing obesity. Now, answer option B, to explain the role of fat molecules in the development. Okay, so now he is talking about the importance of fat molecules in the development of osteoarthritis. So for that reason, he is talking about obesity. That is the reason. Okay, why means reason, purpose. Answer option C, to illustrate how attention to diet can alleviate these symptoms. Okay, so now he is telling how attention to diet. So if a person is giving close attention to their diet, how it can alleviate the symptoms of osteoarthritis. Right. So now let's do the focal point identification. That is the key verb analysis, right? To show how assumptions about it can be wrong. So he is showing assumptions about it can be wrong. Okay. So assumptions about osteoarthritis in the hands, and he wants to prove it wrong. Okay, so assumptions. Okay, he wants to disprove. He wants to disprove the assumptions. So I would say that the main keyword is basically this one. Okay, so let's just make the corrections over here. Now, when it comes to answer option B, to explain the role of fat molecules. Now, the reason why he's bringing obesity is to talk about the role of fat molecules in osteoarthritis of the hands. And finally, answer option C, the focal point is how attention to diet. Okay, so how diet can alleviate these symptoms. So if a patient is eating a very healthy diet, how it can reduce the symptoms of osteoarthritis in the hands. Now you see over here, now you have minimized it. Okay, now you have made it much more smaller. So now when you're listening to the audio, you should look only into the answer options. You should not look into the question. Your eyesight should only be in the answer options. Okay, the why. Okay, so he's mentioning obesity because he wants to prove some assumptions are wrong. He wants to illustrate the role of fat molecules and to show how diet can elevate these symptoms. Okay, so again, this is a slightly tough question over here. One of the toughest questions I have basically come across in OET. But anyway, let's take a look into the audio script. Let's take a look into the audio script. So everyone remember the question. He's talking about osteoarthritis in the hands and he's using obesity and your duties. So what is your duty? Why is he using obesity as an example over here? Now let's take a look into the second question. It's a very tiny paragraph, but it's very, very complex. Okay, let's take a look. Now he's saying, let's look at some more of the myths surrounding osteoarthritis. So in the very first sentence is talking about the myths. Myths basically means what? As I told you, assumptions. Okay, people, that is, it is baseless. Okay, people, rumors, myths, assumptions is what we call as all these kind of things. Okay, so there are more myths. Okay, not scientific evidence regarding osteoarthritis. People are believing some kind of stories. Okay, so let's see what now he's talking about a story. Okay, let's see what he's talking about. Okay, osteoarthritis of the hands is an interesting case. Now, directly he's coming to the hands, osteoarthritis of the hands. That is in the question. Okay, now he's saying it is an interesting case. So see, now he is talking from his perspective. Okay, so you have to think, okay, so according to Michael, this is very interesting to him. Okay, so one he is finding interesting, he will use certain words, he will use certain tone, he will use certain stress to show how interested he is. Okay, so osteoarthritis of the hands is a very interesting case to Michael, not to us, to Michael. Now, why? He's saying because. So why is it very interesting to him? Because he's saying this is one time you might think you cannot put the blame on mechanical load factors, but you would be wrong. And let me tell you, this entire portion, this entire sentence from here to here, even though it is a very, very tiny sentence, it is one of the most advanced sentence structures you would come across. Now, what is the meaning of this particular portion? Okay, now he is saying, according to him, osteoarthritis of the hands is a very interesting case. And now he's telling his reason. So he's telling this is the reason why I feel it is very interesting. Okay. And he's talking about the myths as well. He's talking about the myths, that is assumptions. And he's saying this is one time you might think you cannot put the blame on mechanical load factors. So as I told you, load basically means what? Weight. Okay. So osteoarthritis is about the joints. All right, osteoarthritis is basically about the joints over here, and the joints are having too much load. Okay, mechanical load means basically they're talking about the joints have to carry so much weight. Okay, and he's saying this is one time you might think you cannot put the blame on mechanical load factors, because you see over here, when it comes to the hands, okay, when it comes to the hands, is there any body weight? Say, for example, let's say that we have a very obese patient. Okay, we have an obese patient. Now, his knees. Okay, what about the knees of the obese patient? The knees of the joints in the patient's knees, they have to carry too much of mechanical load, right? Mechanical load for the knees is too much. Okay, and also the maybe the spine, maybe the hips. Okay, because the patient is very, very heavy, the joints in the hips also are having too much of mechanical load. So we can say okay, the reason why you're having osteoarthritis is because your hip joints and your knee joints are carrying too much of mechanical load. But imagine a same obese patient and think about their hand. Now see, this is a hand. Now is there, see, even if a patient is obese also, there is no stress for the hand. Okay, there is no stress for the hand, right? So here he's saying, okay, now that is why he's saying this is an interesting case. Okay, osteoarthritis of the hands is an interesting case to him because he's saying this is one time you might think you cannot put the blame on mechanical load factors. That is, he's saying, okay, blaming means what? Blaming means pointing fingers. Okay, you broke the um, iPhone. Okay, or you broke, that flower vase. Okay, blaming means pointing fingers. Right. So he's saying if we have an obese patient, okay, so this is very, very tough. Okay, let me just draw over here. Okay, so we have an obese patient over here. So let's imagine this is an obese patient, right? And this is the this is the hands. Okay, this is the hands of the obese patient. Okay, the hands of the obese patient. Now you see over here, now the legs. the poor legs and the poor knees, okay, these joints, they have to carry a lot of mechanical load. But the hands over here, they don't have to carry any mechanical load. So we cannot blame. So if someone is having osteoarthritis of the hands, we cannot point fingers at the person. Okay, you are getting osteoarthritis of the hands because you're obese. Right, because people think, okay, the hands, poor hands, okay, they are not, um, they are not lifting, they are not under any kind of stress. Okay, they are not under any kind of stress. So we cannot blame their body weight. Okay, so mechanical load basically means their body weight. So here he is saying, okay, that is, let me just type it over here in a little bit more easier sentence. So, you cannot say to an obese patient, because one time you think you cannot put the blame on mechanical. Okay, you cannot say to an obese patient that you have osteoarthritis because of your body weight. Okay, so I'm trying to make it as simple as possible. Okay, because it's very, very tough English over here. Now, is it making sense to you? Okay, so we have an obese patient and they are having osteoarthritis of the hands, right? Okay, so can we blame the person? So if imagine that I'm having osteoarthritis of the hands. Can you blame me? Okay, you're the reason why you have osteoarthritis of hands is because you're obese. Okay, so you will say no, you cannot, because the hands is not having any mechanical load. Okay, but he is saying that is wrong. Okay, so that is actually wrong. Mechanical, that is, it is related. Okay, that is the mechanical load of the body is related to osteoarthritis of the hands. Okay, so again, this is what it means. So that is the meaning of this. Now let's come to the next sentence over here. They are actually now he's saying, now he's talking about it. There are actually circulating molecules that come from fat. Okay, so when a person is having too much of mechanical load, basically means what, the person is obese. Okay, the person is having too much of fat. Okay, now there are some circulating molecules that come from fat. Okay, so we know adipose tissue. Okay, fat basically means adipose tissue. From this adipose tissue, some kind of molecules are actually becoming released. Okay, and these influence the development of inflammation in joints. So now you see, even if a patient is obese, their hands also will get osteoarthritis, even though the hands are not suffering from mechanical load. Why? The hands also will get osteoarthritis without any mechanical load, because there are some circulating molecules. There are some circulating molecules that is getting released from these fat. And these circulating molecules, it influences the development of inflammation. Okay, so these molecules, it actually causes inflammation. So even if the patient is not having mechanical load over here, the fat molecules, it releases the fat releases some molecules, and these molecules results in the inflammation of the joints. So the patient will develop osteoarthritis of the hands. So he is saying, people think everything is related to mechanical load, but that is not the case. Even if the hand is not at all using, if the patient is not at all doing any kind of mechanical load, still they will get osteoarthritis of the hands, because if they are fat, if they are obese, some chemicals will be released, and these chemicals result in the development of inflammation of the joints. Right. So he is actually clarifying it. Okay. So he's saying this is a myth. Okay. So what is the myth over here? So he's talking about the myth of osteoarthritis. The myth is that is only mechanical load. People saying mechanical load is equivalent to osteoarthritis, but that is the myth over here. So he is saying that is a wrong information. Even without mechanical load also, even without mechanical load, that joint will develop osteoarthritis. So he is clarifying the myth. Okay, Michael is basically correcting the myth over here. Okay, now he going to talk about obesity. Now our duty is what? Our duty is to find why he is bringing osteoarthritis. Now he's saying, in fact, you are 30% more likely, to get hand osteoarthritis if you're obese. So if you're obese, 30% more likely. Now you see over here in the obese patient, they are not having any mechanical load on their hand, but still they will get 30%. They are likely to get osteoarthritis more. Okay, and there are a couple of studies. Now he's saying couple of experiments has been done going on right now to test this theory that losing weight can have a positive effect on osteoarthritis in the hands. Now he is saying currently there are some studies going on. Now see what will happen if we lose weight. Okay, so I'll just highlight this once again. So what will happen if we lose weight? If we lose weight, this mechanical load over here, okay, no, okay, these chemical molecules. This one. Yeah. Okay. So these molecules over here, right? These circulating molecules, okay, that come from fat, it will decrease. Okay. If a patient is losing weight, then these circulating molecules from coming, it will decrease. And if this decreases, what will happen? In development of inflammation will also decrease. Right. And like that. So if the inflammation is decreasing, then that will have a positive effect on the osteoarthritis of the hands. Okay, so this is a very, very complex question. See, again, this is how you should, dissect one question. This much clarity, and only then you should go to the next question paper. Okay, simply doing one question and saying, okay, I did this and I got this many correct answers, that is not enough. So even if you have done this question paper previously, can you say that this much clarity you have and then going to next question paper? That is the way you should prepare. So this method, if you're implying, then just 2 3 4 materials, that's it. 3 4 materials you only prepare, only practice, but that much thoroughness you bring, then clearing the OET becomes extremely easy for you. But you need to have that, that expert guidance and mentorship you should be having. Now let's come to the answer options over here. Now let's talk about answer options. Answer option A, to show how assumptions about it can be wrong. Now, don't you think now he is talking about obesity? Assumptions basically means what? Myth. So what is he saying? There are certain myths, okay, about obesity. And what is the myth? Everyone is saying if there is mechanical load, only then they will get only then they will get osteoarthritis. But he is correcting that myth. He is saying even if a joint is not having mechanical load also, okay, that joint will still get osteoarthritis because from the fat molecules, some chemicals are released and these chemicals leads to inflammation. Okay, so he is basically bringing, so he's talking about obesity. So what is the reason? Why is he talking about obesity over here? He's talking about obesity to clarify a myth. That is, he is saying there are certain assumptions and it is wrong. Okay, so that is the reason, that is the purpose of bringing in obesity in this particular case. Right, so the correct answer option is A, because as you can see over here, he wants, okay, he's bringing in obesity. The reason why he's talking about obesity is to tell us that that certain assumptions are wrong. So he's saying about certain assumptions and he is saying it is wrong also. And again, I'll give you some trick over here. Again, this is a very difficult question, but towards after I discuss this, I'll give you small tip, not a trick. There are no tricks in OET. There are only tips and strategies only. Now let's come to B option, to explain the role of fat molecules in its development. Okay, now this is partially correct. Okay, now he's saying, okay, partially, okay, it is correct because he's saying there are certain fat molecules and fat molecules, it leads to osteoarthritis. Okay, that is correct. Okay, he's talking about the role of fat molecules in the development of osteoarthritis, but that is not the reason. Okay, even though he's saying this, your duty is to not find what he's saying. Your duty is to find why, the reason why he is talking about obesity. So the reason why he's talking about obesity is to make us understand that there are certain myths, there are certain assumptions, and it is wrong. That is the reason. That is the reason why he is bringing obesity. He is not bringing obesity to tell us how fat molecules causes osteoarthritis. So even though B, you may be tempted to choose the correct answer if you make the connection to the why over here. The why is the question stem. So remember the question stem, and that we should never forget. So the stem is the reason. And for that reason, even though you may be tempted to choose B because it is correctly mentioned, it is going to be answer option A. Now let's come to C answer option. C answer option is telling to illustrate how attention to diet can alleviate these symptoms. So that also they are talking, no, attention, that is losing weight. Okay, in the towards the end, he is saying if the patient is losing weight, it will have a positive effect. Okay, so alleviate the symptoms is mentioned. Okay, alleviate the symptoms is mentioned, that if the patient is losing weight, it will have a positive effect. So that is mentioned. But did we read or did we hear anything about diet? That is, if the patient's diet, if the patient is concentrating, then it will help in this. No, nothing related to diet. So this keyword is not at all mentioned. So since that is not mentioned, we cannot choose answer option C. So C is something that you can very easily eliminate. Now you're stuck with A and B. Okay, so now you see at least one C answer option. If you're able to eliminate, now you have a 50-50 chance. Now, if you're very lucky, if you may choose answer option B, and that will be the right answer. So this is how you should bring in the elimination strategy. Now I'll just play you the audio once again. Okay. And this time I want you to focus on how the patient is speaking, how the person is speaking. Now, see, he's saying interesting. Okay, there are certain myths. Now, see, he's beginning with myths. See, the audio script is beginning with certain assumptions. So that is the message over here. That is the see, his entire focus is on assumptions. There are people who are believing wrong information. Okay, and this is a very interesting case. The interesting case of hands. And now he's proving. So he's having a lot of joy in telling us why it is a wrong assumption. Okay. And then he is talking about obesity. So obesity is just a supporting point to tell us why he believes certain myths are wrong. Okay. And you give importance to how he is saying as well. Okay. Interesting. Okay. Influence and all these 30% more likely. He'll put in some extra stress. Okay. Some extra emphasis will be there in the way he's speaking. And that is a clue for you to choose the correct answer option. Okay, so I'll just play the audio once again, and then we will go to the document that I have prepared. Alleviate the symptoms. Now let's hear the audio.
Let's look at some more of the myths surrounding osteoarthritis. Osteoarthritis of the hands is an interesting case because this is one time you might think you can't put the blame on mechanical load factors, but you'd be wrong. There are actually circulating molecules that come from fat, and these influence the development of inflammation in joints. In fact, you're 30% more likely to get hand osteoarthritis if you're obese. And there are a couple of studies going on right now to test the theory that losing weight can have a positive effect on osteoarthritis in the hands. So what?
All right. So okay. So that's clear, right? Okay, so this is that repetition. Okay, so I just want to say one final thing before we go to the document. The mind learns through repetition. Understand this. Trust me, I have learned psychology. I graduated from Singapore. The human mind, okay, the human mind learns anything through repetition. The more you repeat a same activity, the more you're going to learn it. Okay, so you have to expose yourself to the same questions of Cambridge materials repeatedly. That is the only way you're going to learn quicker. Okay, if you don't repeat, if you don't expose yourself to the tough questions repeatedly, if you're simply doing material 1, material 2, material 3, then there is no repetition. It is just fresh information coming and coming. You're not going to learn any strategies. So if you want to learn strategies, you have to put yourself, and it's going to be an uncomfortable process, repeating the same thing. Now, for example, let's say that we have some religious books, right? So like the Bible, the Bhagavad Gita, and so forth. The more the more times we read, if you read the Bible 10 times, the 10th time you'll get more information. The 10th time you read a Bhagavad Gita, you're going to get even more information, right? That is the same with OET. So maybe the 5th time, the 6th time you do the same question, you will learn, some information will come into your mind. Okay, this is how you self-discover the right strategies. Okay, no one reads the Gita and the Bible just once. Okay, you read it on a continuous basis, and the more you read it, the more information you keep on getting. So that is the same magic that is applicable over here as well. Right. So I'll be giving you some random tips and all like this. So this document also I have prepared, the 30th question. So I will be sending this document to you through WhatsApp group. and you can take a look into it. Okay, so over here, this is an inference type question. So if you have to understand what question we're dealing with, so the inference type question, and that means the answer is not said directly. They will not say it. Okay, they will not say the answer directly, but you have to infer it. You have to use your logical reasoning to come to your own conclusion. Okay, and there are certain strategies over here. Again, listen to the purpose. Okay, the reason means why he is bringing obesity. Notice the surprise. Now you see the tone. Okay, he's saying interesting, right? So that is a surprising information. So you have to give importance to the tone, the stress, the attitude of the speaker, not only the English that is coming. Okay, and then eliminate wrong options, look for corrections. And also I have made a vocabulary list over here. So I'll be sharing this document to you through, and you can make some notes. Okay, so this is how you should be able to um, develop. Okay, so let's just have a small recap of the session for today. So today, what did we say? All right, so we have, so we talked about OET Listening Part C. Okay, so we covered two very important, very challenging inference type questions. Okay, that is identifying complex causes. That is about osteoarthritis, right? That is suggesting regarding helping patients. Okay, so that was a inference type question as well. And the second one was about correcting a false belief. False belief was an assumption. And here the entire reason for speaking that was about correcting the false assumption or a bit myth. Okay, and so here we had a very clear explanation of what inference type questions are. We went into very detailed step-by-step strategy, that is comprehension, retention, detection, keyword analysis, verb analysis, elimination strategy, understanding from the perspective of the speaker, okay, thinking like the speaker, identifying distractors, identifying the question stem. Okay, so we discussed all that to find the correct answer. And then we also did some vocabulary exercise as well. And we talked about very important tips to help you stay focused. Now, you see, if you highlight the important words, underline the important words, you will be staying ultra focused. And as I told you, to improve your confidence levels, quality reading. Don't read it 3, 4, 5 times. Just read it one single time. That is enough. Right. So this is what we discussed today.